I don't think so, unless you want to use the microphone for the people in the room.
Potentially celebratory, but will the outfit come up?
Let me get a wireless mic for that piece.
Question for you. Great postcard. Does this count? The back of your actually list. Purchase it. Stick it on like this.
Yeah.
Yes, we will.
Yeah. Yeah.
We still see people coming in, so we'll start in a minute.
Someone online said that I was left of Marie with some agony. I don't know what that means, but.
Thanks everyone for being here. My name is Carrie Wallace. There's a slide in here to do some introduction, but I did just want to say a huge thank you to the library for welcoming us into this space today. And a huge thank you to the leaders and voters for collaborating on this event. They
They
have
have
being
hand
here.
in, helping
My
us
name is
prepare
Carol.
for
It's
today and
here to
promoting
do some
today, and
introduction,
really
but-
appreciate the collaboration in that space. We've added some slides to this deck to help articulate the alignment of our views with the lead views on this particular issue. And there will be time for questions and stories if you want to share yours throughout this presentation. So just letting you know, there is some opportunity to share, sharing, and definitely opportunity for questions, especially at the end. So feel free when the time comes. So my name is Carrie Wallace. This is my contact information. If you would like a copy of these slides, we just need a legible email address on the paper in the back. And we will send you a copy of these slides. You'll have my information as well as information in the slide deck, and all of the links that are in here that are live will be accessible to you through the slide deck. I'm a nurse. I've been a nurse for over 20 years. I graduated from LCC originally, and then I've done some additional master's degree. I'm a dues paying member of WSNA and National Nurses United because I believe in collective bargaining. My personal position is not represented, but I think that workplace democracy, strong workplace democracy makes for strong democracy in our country. It's a little bit about me and my background. I'm also the board chair for Whole Washington, which is the organization I represent here today. And we are on this town hall journey across the state to try to get folks aware of the fact that we exist and that this issue is really important to us, and the slides will indicate why. I've volunteered for this organization since 2016. The first initiative I participated in, I collected like 7 signatures. And then our last initiative, my team collected about 2,000 signatures in Calhoun County, which is arguably a little challenging on issues like this, but healthcare impacts everybody, and so we're talking to everybody. I've been the board chair for Whole Washington for about 10 months now. Volunteering with Whole Washington has absolutely been an amazing experience. I've met some really incredible people. We have some really engaged, dedicated volunteers, especially in our leadership. And some of those folks are in this room today. So I can't say enough great things about the organization. My story, one of the reasons why I care so deeply about healthcare and universal healthcare, and specifically state-based single payer healthcare, is because of my experience as a nurse, but also my experience as a human. My uncle had colon cancer, was diagnosed about 7 years ago. It was in remission. And he was on a very expensive medication that was keeping his cancer at bay. And his insurance company decided they didn't want to take medication anymore. So they couldn't afford to pay it out of pocket. It's like $3,000 a dose or something crazy. And so he stopped taking it, and cancer came back. And it came back in his colon, came back in his lungs. He had a tumor on his throat. He was a professor of communications on the East Coast. And he had to keep working to keep his healthcare insurance while he was fighting cancer. They removed the tumor on his throat, and he taught class at a whisper. He was like literally grading papers on his deathbed. Died within 7 months of the insurance company denying payment for his medication. So it's just tragic, and it's not unique. It's not my family. It's not the only family that's experienced this type of situation from the healthcare systems we've got. And so we think the stories are really impactful and they'll make a difference. I'm going to share with you lots of statistics about universal healthcare, how it can save money, how it can improve quality of care. These are not things that are new. There's 36 other countries that are already doing this. They're not things that our legislature doesn't already know. We're nonpartisan, I'll cover that in a second, but all of our legislature knows how much money healthcare costs right now. They know that the quality is impacted by the for-profit motive of our current healthcare system. And we really believe that it's that story, telling our story, they're going to truly change their heart and mind. And so that's what we've really centered stories in this town hall journey we're on right now. Leah, do you want to introduce yourself a little bit?
So, hi, my name is Leah Purple, and I'm like Carrie. I've been working on this since 2016. My friend Dorothy over here actually got me involved in when they launched their first campaign in 2016. Didn't know a lot about it. Haven't had any stories that affected me by not having universal health care. I collected quite a few signatures, at that time. Most of my life I've been in customer service. Some jobs I've had insurance, some jobs I haven't. It really makes a difference when you don't have insurance, that you have insurance. I'm a former union member. As a union member, I did have very good health care. But I think as I look back as a union member, if we would have had universal health care, that would have been something that we wouldn't have to fight so hard for. We could have been fighting for setting up for better wages and better benefits. So I truly believe that, universal health care is a factor in that. I was also a signature captain, not this last time, but right before COVID had happened, or right after COVID had happened, I believe. We were actually, at that time, there were lines to get into the farmer's market. We were overwhelmingly filling our sheets. Me, myself, my husband, my volunteer, my good friend Sarah here. It was amazing how many people were signing that initiative. Doctors, the people in the medical industry, they see firsthand, like Carrie had, they saw firsthand how their patients really needed that help and they couldn't afford all the medicines that they needed. I actually met one mother who she actually had to put her daughter back on her insurance because her daughter had diabetes and she could not afford her medication. So her mother was actually having to pay out of pocket for her daughter so that she could keep her alive and healthy. So my story, really came to light 5 years ago, when I was in between jobs and we had what you call, Obamacare. When it's Affordable Care Act. So I was through a temp agency going to get my union job. It was a 90-day, to get before I was an official employee. So I was paying $100 every week for insurance. My husband at the time's company had dropped his insurance, so he didn't have any. So he had a heart attack he had 2 of them. Final one was on a Saturday night in the hospital. It was either he died or we do the surgery. So long story short, $130,000 later in debt, we are actually still paying off that debt. Now we do have insurance. And it isn't really, I mean, it's good that we have it, but my husband had cataract surgery several months ago. With insurance, we're still paying we have to pay $2,600 off. So even with insurance, we still get your co-pays, and so that's affected us a lot. So that's my story, and I really truly believe that it's time to move towards universal health care.
Right, so we represent Whole Washington. I mentioned that Whole Washington is a grassroots, nonpartisan healthcare advocacy organization, made up of regular people. Our board is largely nurses or healthcare providers of some kind. We were founded by Kathy Angel, who's a nurse, passed away during our first initiative. She had brain cancer. And Georgia Davenport is really credited with keeping the organization together after Kathy's passing. It was really difficult. Georgia's story, I'm hoping will share. Is that going to work on Zoom? Maybe I'll just tell it.
Yeah, I think
We had technical difficulties. I'll just tell the story. Georgia's story is so much better from her words. It comes to us from the Healing Us documentary. The link is in the slide. You can also find the Healing Us documentary on Amazon Prime and Cinema and other places. I highly recommend it. Very great movie, put together very well. It does center a couple of Washington advocacy, healthcare advocacy groups, both us and the Red Berets for Medicare for All, which is a practice organization that started in Tacoma. And then some other, Michael Potter, who's considered a whistleblower out of the insurance company organization. Susan Sarandon does the narration. It's very well put together. It's definitely changed some hearts and minds. So Georgia's story, she was pregnant and qualified for a Medicaid expansion product that was covering her pregnancy until her baby died. And so she tells her story about how, as soon as her baby no longer had a heartbeat, that Medicaid expansion insurance product no longer covered her Medicare. Her medical expenses no longer covered her care. So she did what's called a DNC to help move that miscarriage along. And it was gonna cost $3,000 out of pocket, $3,000. So she went home and over the next 4 days, essentially had labor, to carry out that miscarriage. Just because she didn't have the money and the insurance coverage would no longer cover her. And so that is something she said, no person should have to do. One of the reasons that she got involved, with Pay Washington was really to just prevent those kind of stories. Our overall goals, universal people for healthcare in Washington state, and an expanded and improved Medicare for all type program nationally. Nobody likes the term Medicare for all. I just want to throw that out there. We know Medicare sucks. It's missing coverage for your eyes and your ears and your teeth, which is crazy considering all if you age.
Yeah.
You need hearing aids and dentures and eyeglasses. So, it's the expanded and improved part of that is very important to us. And things that are covered inside the Washington Health Trust, we'll talk about later. The League of Women Voters, is in alignment with our vision for universal healthcare. They are not neutral on this topic. There's a ton of research around this topic, and not something that they make statements very lightly. There's a ton of research goes into, positions that the league takes. And Washington does happen to be in alignment with their position. The bottom part of the league supports the single care concept as a viable and desirable for implementing league decisions on equitable access, affordability, and financial feasibility. In a proposed healthcare financing system, the league favors health insurance access independent of employment status. And that piece is something that's paramount inside the Washington Health Trust, and we'll talk about that. Our goals for today, is to create opportunities for genuine conversation. We're running all around the state as a small cluster of volunteers that have these conversations to introduce ourselves, to really have a dialogue with you guys about what's possible when we take the insurance companies out of our healthcare system and decouple that coverage from employment so that it's fair. It's there if you want to start a new job, it's there if you want to quit, it's there if you have healthcare concerns of our own. It's just always there. There are other pieces happening in our state that folks might not know about. We do have a Universal Healthcare Commission that has studied our policy. We've done a couple of presentations. There's some more information in the slide about that. But the Universal Healthcare Commission is not a body that's full of healthcare advocates, if you will. There's 2 Republicans and 2 Democrats. Smattering the folks that have been appointed by the governor, some of which represent the healthcare industry, the insurance industry. So, it's been a challenge to get real solid policy guidance coming out of this commission so far, but it's also been a really great platform for having conversation, for telling our stories, for getting involved and letting the legislator know that we want this to be better and we want things to get better. We're also hoping to collect feedback through this process. Whether you give that feedback today or you go on our website and give us some information, send us an email. Does our policy represent you? Is there something missing? Is there things we haven't thought about? One of the town halls, we had a gentleman who talked about their disease process and how they have to take a bunch of antibiotics. And probiotics are not covered by their insurance, they're covered by our health insurance. So is that covered by the trust, right? So making sure that those types of scenarios that we thought about all these pieces is another reason why we're out here in your community. We also would love to build a coalition of active volunteers as we move into the next potential initiative cycle. So why are you here today? Is there anything we should know about you? Anyone want to share what brought them to this room today that might help us give you a better presentation? There's all kinds of things to talk about in this school.
You're the new kid on the block. And that's effectively the first time, and then the presentation you made once before at Salmon Creek.
Okay.
Sweating by it. Now, sharing it with others, they know you exist, they just don't know where to go. Why aren't they here? I don't, there's gotta be an answer why they're showing.
Thank you. Anyone else? What brings you here today? What are you hoping to get out of it?
Well, the one thing is, I didn't used to have healthcare before the healthcare came in. And I went through cancer and there was some healthcare, I was on that program. but it wasn't that good either, they still had bills and stuff, and I don't think healthcare should be a right, not a privilege.
Yeah, thank you.
Here, plus, everybody's over at Juneteenth right now, I just walked for.
Yeah. Summer is hard. Yes.
So I have, what most would consider really good healthcare to my employer. Yet the payments for when you need to use that is, so I've got and my family's, we're all relatively young, we've got a couple of children ages 17 to 7. And my 17-year-old, one night she had this really bad pain in her lower abdomen. We got it appendicitis, went to urgent care. They said, you gotta go to the ER. They did a bunch of imaging. Nothing came up on the imaging, so they couldn't tell what it was. And she was in full pain. And they basically said, well, there's nothing we can do, so you just have to go home. If it gets worse, come back. He ended up going to the ER 4 different times. And she ended up having to pull out of school. She couldn't any longer attend school. She was laid up in bed and unable to eat. She lost all over 15 pounds, but she didn't have. And the last ER visit, we said, look, you know, we're seeking a referral to a gastroenterologist. Because they couldn't find anything else, and they said that's the next step. They said, well, we can get you a referral, and this was in February, and they said, we can see her in August.
Ah.
It's like, what, you know? Yeah, and meanwhile, she's unable to eat, she's just laid up in bed, just wasting away. So we ended up driving up to Bellingham, where there's a gastroenterology facility that doesn't require a referral.
Okay.
And this is like, we are battling doctor, you know, like, it's often said, you know, you have to be an advocate for yourself. You want to get the care that you need. It didn't matter how hard I was pushing, who I was talking to, like I was hitting it from every angle with all my effort. And it was just roadblock after roadblock after roadblock. And, you know, they still couldn't figure it out. So we ended up going to a naturopath. And, you know, you mentioned the probiotics, and, you know, they did some other testing, and it turns out that, you know, she has something called SIBO, which is overproduction of bacteria in your lower intestine. And, you know, up to that, you know, we were putting her on some probiotics, trying to address, you know, trying to rebalance the flora in her stomach and all these things. Anyway, none of that stuff. The ER visits are, I think, $400 a piece. And what's the outcome? Nothing. Just nothing. Meanwhile, you know, we're paying $400 out of pocket. Who knows how much more is going to these, you know, for-profit megalomillionaires that are just, we're shouldering the cost. And
Yeah.
what,
And we'll
like-
show you there's plenty of money in this.
and you know, it's like, at what point is the public going to say, all right, this is insane. I can't believe I stuck with it for this long, but it has come too far.
Right.
And it's, you know, I'm running for Congress and, you know, that, you know, I'm not here to push my thing, but it's like this, the narrative has been curated to make people feel like if you are advocating for universal health care, that you're socialist or Marx, you know the slanderous things that are leveraged. And it's, you know, and maybe we don't have the answer here today, but what does it take for people to step back, look at what is really going on, and do what is best for yourself, your community, not just be so entrenched that you're pro-business and I'm a capitalist and, this is a free, we need to support this free market. Like, there's no free market about
We're gonna
this.
touch some of that
So,
too.
anyway.
Yeah, very long comment, but I appreciate all the
Yeah,
points. and
sorry,
we're
but-
gonna come back to several of them in the slide deck, so I'm really glad that you're here. I think you had your hand up.
Sure. I'll make it quick. My name is Paul. I worked in lab for about 10 years and I switched over to working in public health, healthcare IT and a bit of biostatistics. And I mean, just over my career, just seeing probably countless people get screwed like by the health insurance companies. Because ultimately it comes down to, it's a gamble. I mean, it's kind of like, your employers and I mean, my employers just saw like double-digit percent increases after the pandemic emergency was declared over, of course. And all sorts of people are, cropping up, I mean, there's autoimmune conditions cropping up all across the board right now. Grover's disease, I have a friend that right now has lupus that are, after, fairly healthy, pretty active people that are just kind of coming down these conditions. I said I was gonna make this quick, so, but anyway, what I really wanted to, get out of today is just kind of like learn more about this, kind of approach to actually deliver healthcare, not a gamble on the healthcare. Maybe we'll say, maybe we won't.
Perfect. Don't lose your questions, we'll come back to them. So why do we need universal health care? There is a strong correlation between affordable health insurance and our lifespan. This is Washington State, all the dots represented county, where folks are more likely to have good insurance to be able to afford their health care, their lives are longer. We live longer, healthier lives if we have access to health care. If we don't, then we don't, right? So all the barriers that we've talked about already, the networks, the insurance barriers, the things that, the costs, all these barriers really do affect our overall health and wellness and our outcomes. This is a slide that shows we, as the US, are an outlier when it comes to how much we spend. So we talked about, all the 4 ED visits, how much does that cost? Your insurance premiums every month, your deductibles, the out-of-network cost. You can go to an in-network hospital and end up with an out-of-network ED doctor. So even when you're doing it right, you're doing it wrong. All of these things are made up. Aspects of insurance that don't need to exist is really the premise of our entire conversation. And all of that drives up the cost of our healthcare, every little bit. We did a presentation in Seattle with Dr. Hugh Boyce from the PNHP, the Physicians for National Health Program. And he talked about our US healthcare system is not a system, it's the modern day gold rush. There are tons of different ways in which middlemen, insurance companies, pharmacy benefit managers, hospital corporations and consolidations are all really pointed at just pulling profits out of the system, not providing healthcare. The focus of healthcare should be the patient. It should be you and your daughter at the center of your care. That's not what's happening here. So, here's some highlights from the Commonwealth Fund, around healthcare spending. We spend more, both per person and as a share of our GDP than any other country. We have the lowest life expectancy at birth and the highest death rate for avoidable treatable conditions. So the gentleman over here talking about lupus and those long-term chronic diseases, the US does a very poor job of managing these things over time. And it's because we're focused on pulling profits out of the system versus taking care of patients. The US has the highest rate of people with multiple chronic conditions, so comorbid, oh my God, I can't. Comorbid conditions. Nearly twice the OECD average, and someone asked me what that stood for, so I made sure I had it ready. It is the Organization for Economic Cooperation and Development. So they keep track of worldwide, not just healthcare, but a lot of different aspects of economic development. And so that's where that comes from. Americans see physicians less often than people in other countries. We have less doctors per capita than other countries. And our doctors are spending an exorbitant amount of time just trying to fight to implement your care plan and then get paid for it.
And we will talk some more about that. Leah, you want to take this question?
Okay, who here has ever worried about being able to pay for their healthcare? Sarah had hers up first.
If you're willing to share.
Oh, I don't know, I mean, so over the years, we've either had healthcare or we haven't had insurance, so we were. In the times when my husband didn't have a job and had insurance, or was between jobs, you know, definitely worried about what if something happens during that time. We don't have the healthcare to cover. We can't, I mean, so we just don't go to the doctor. That's what it resulted in. This,
Somebody over had their hand when you guys there. Anybody else? Go ahead.
Client did an ingenious idea. Ultimately, he had an application, but he had a credit card and roll over the balance onto a new one with no interest rate. He did that for a long time to the tune of, and went into bankruptcy court. So, and he had diabetes and he had lost part of the leg. So Jeff was probably empathetic, but I thought it was ingenious. There was no way he was gonna be able to come up with only insurance. And I got it all written.
I'll tell you, we had multiple people ask us why we didn't file bankruptcy on our own. It's a common question. Okay,
Just one quick question. So, you know, a big part of this, and maybe you guys, discussed this, is leading to this significant uptick in these health outcomes. And I have a belief that it has a lot to do with our food supply and, you know, the food we consume is ultra processed, just garbage masquerading as food with who knows what's going into it. We're consuming it and it's more and more. And, you know, I know that that's not directly related to this.
We don't
but
touch on that
you know what?
concept in here, but we talk about the financial pieces.
Yeah.
For sure.
Washington Health Trust, better for individual families. So do you want to go down the whole brief list of what? Okay. So in 2022, 27.6 million people in the US have no, okay. 2022, 27.6 million people in the US had no health insurance. In 2023, and then it went up to 17.5. Of those 19 to 25 have no health insurance. They're probably young people who work for Starbucks or something like that, or baristas at a restaurant. 2022, 46.5 million people ages 19 to 64 are underinsured Commonwealth Fund. 2022, there were 387,732 filed bankruptcy as a result of medical expenses. Annual use note, peer countries had no bankruptcies due to medical expense. That's pretty amazing. 10% US adults have medical debt equaling 88 billion in collection. 250,000 GoFundMe campaigns annually to raise money for healthcare needs. I don't think anybody should have to do a GoFundMe to pay for the healthcare. Rising premiums, deductibles, and co-pay limit policy costs also tend to limit access to healthcare. No. Rand experiment found that 2% increase in co-pays resulted in 10% reduction in usage. Avoidable deaths are 336 to 100,000, preventable and treatable.
So interesting that, you know, a 2% increase in copay results in a 10% reduction of utilization. So every time your insurance company nickels and dimes you, raises the cost of the insurance product itself, creates out of network barriers, increases copays, we are less likely to go to the doctor. They collect all of our money up front. They collect tax dollars for Medicare and Medicaid. They collect as premiums for your actual insurance product. And the more delays, the more barriers they can put in place, the more money that they keep because you're not using it for service, right? The more denials, appeals, prior authorizations, all those things are really meant to just keep your money. And I can't stress that enough. So are there any small business owners in here who struggle to pay for health insurance for their employees?
Lady wants to say something.
I'm sorry, go ahead.
Hello, everyone. I advocated with Philadelphia Physicians for Social Responsibility. Our member organization, as part of a larger coalition, gained passage of the Earned Paid Sick Leave Act. My name is Deborah. I was en route to physician assistant training, graduate physician assistant training, but I have background in facilitating mood affective disorder support groups, and I launched my own chapter at Springfield Hospital. What I'd like to say very quickly, because I only have a few minutes, thank you so much everyone for your time and for this forum and on behalf of my fellow allied healthcare team as well. Several years ago here in Vancouver, I appeared on a Vancouver radio station broadcasting, promoting one aspect of the Food is Medicine initiative. And that is a particular model. No, there are two models that I'm aware of patient produce prescription programs. These programs are critical. They target segments of the low-income patient population whose disposition is to be predisposed multi-generationally to cardiovascular diabetes and obesity. One way that we address the aspect of universal health care and reducing the overall costs, improving patient outcomes and overall efficiency is to do everything in our power to promote these types of programs. This particular model that I've discussed on Vancouver's radio station broadcast was called Wholesome Wave. Another model is Veggie RX. I'm not certain, but I believe Vancouver Clinic recently, as of the winter of this year, has begun in implementing clinician scripted access to fresh produce for these patient populations and or their family. I just ever asked everyone to be considerate of that and to determine how, particularly here in Clark County, we can continue to build the campaign that will facilitate this. That in and of itself will drive further efforts to gaining universal health care and lowering the need for pharmacoagents or medication usage. Thank you, everyone.
Thank you. Appreciate that.
Yeah, it's a very important part of the total story for sure. But back to the question, are there any small business owners in here that have had struggled to pay for their healthcare for their employees? And that's okay if you haven't. We were on the coast, Long Beach. There were several that told stories around, but morally, ethically, people do this, but financially, it becomes really difficult to afford the insurance products that are offered to them to cover healthcare for their employees. And as small business owners, a lot of times they'll elect to cover their employees and go without healthcare themselves. So both things are happening in this space, and the Washington Health Trust would be better for businesses. So right now, most businesses are paying somewhere between 15 to 18% of payroll for those insurance products. The number goes up every year because the insurance companies charge more for their premiums every year. I've heard the high 22% locally. The vast majority of us get our health insurance through our employer, 55% healthcare employer. Often employees stay in jobs. There was someone who told a story about her 81-year-old grandma who's still working because she can't afford to stop working because she can't afford her medical care without the job, right?
I mean, I saved the job, right, because of insurance.
Right. Right. I think a lot of us stayed in the job with disability insurance. So decoupling healthcare from employment benefits us as individuals, as entrepreneurs, as creative folks, as all the other descriptions we can probably put on a human. During the pandemic, we also saw this in real life.
all the places that shut down, folks lost their jobs, they also lost their insurance and their access to healthcare. You had,
Yeah, it's really the reason to be at this presentation. It's hard hitting, and I'll pay money to have this information, so put in the written form. But walking the line when the nurses were out there.
Yeah.
On Mill Plain, and there were the military experience, I think, I guess, the teachers. Never did I hear anyone talk about that last point. And it seems as though that's lost in all the diatribe.
yeah, the union point, we are really trying to get, our foot in the door. We've got several union groups in policy right now. Because this is a big piece of the puzzle. They spend a ton of time at the negotiating table, fighting for better health care. They really see their, union benefits as a recruitment opportunity for union jobs. But there's a slide in a different presentation we've used that shows that other countries with universal health care actually have higher percentages of union points. It's not necessarily doing that recruitment piece very well. It's also taking away from all of the other things they could be negotiating for at that table. Safety, staffing, in particular, staffing is really tricky right now, and that impacts all of us, right? Working conditions, the stronger unions are, the stronger other surrounding jobs are, and that's just how it's been historically. If you look at a lot of the we've got a weekend because of unions, we've got higher wages because of unions. So I think that's why we talk about unions so much, even though the total percentages of union jobs in this area are not very high. And then the loss of healthcare is often the primary threat to workers on strike. So you're talking about the nurses on the picket lines, you're talking about teachers. There is a huge union strike movement across our country right now. I can't think of a single union that's not considering gone on strike in the last 2 years because of things like this, the same issues that we're having with our health premiums going up and the out of pockets going up, and it happening to union folks as well. If we can all get together and do this differently, it would benefit all of us. So why is it so bad? It's really big money in politics. The impact of Citizens United, the legal bribery that's happening at the political level, is having a downstream effect in every aspect of our lives. Insurance companies I mentioned earlier are paid up front. A lot of the money that we paid in for our premiums during COVID when we couldn't access services, they pocketed it hundreds of dollars. There's inflated CEO salaries and bonuses. If you look at their 7 health insurance CEOs that took in a record of $283 million in 2021. That's 7 people that pocketed $283 million of our healthcare premiums, our tax dollars. That's our money in their pocket. And that's what's wrong with the system. It really is the modern day gold rush. Big pharma, we pay more than any other country for the same medications. Hospitals are consolidating. There's a hospital company that's not local. It's HCA, Healthcare Administration, I think it stands for. The folks that own that hospital company considered buying Kentucky Fried Chicken chains and bought hospitals instead because it was worth more money. These are the people that are running our hospitals right now. The system's built with the wrong incentives. Washington State has a health transparency board, but I would argue that no amount of transparency is going to fix this imbalance in market cost. This link is to another clip from Healing Us, describing why removing insurance companies is a really good first step. It talks about the fact that this money in politics impacts all legislators, not Republicans, not Democrats, all of them, right? We are nonpartisan. It impacts every piece of legislation that goes through. The huge insurance companies, Sigma, United Healthcare, et cetera, they're driving the bills that our legislators are passing right now, and it's an absolute conflict of interest. But it's legal. So, how long are we gonna put up with it is the question, right? What are we doing about it? How long are we gonna put up with that? That's really up to us.
I think Wendell Potter does a really good job of describing working for an insurance company and why he left it, because he actually watched a little girl die and they finally got approved for their insurance. It's too late. And that he just couldn't do it anymore.
Yeah, Wendell Potter was the spin doctor for Cigna Healthcare for a really long time. He's featured in this documentary. It's very good. Can't say good things about it. Everyone has a story. Another reason why we're here in the communities is because we know It's not just me and my uncle, it's not just Leah and her husband, this is happening to everybody. The medical debt is absolutely astronomical, and it's really immoral and not necessary. There's no reason why we should be paying into a system and then also owe money. There's no reason why we should get to a point in our age where we're having normal aging processes. Everyone's going to have a disease at some point, but now my house is at risk, my retirement at risk, because I can't afford the bills that are coming along. There's an absolute lack of access to healthcare services. I don't know how bad Clark County is. I know they had some issues with
We're losing doctors.
hospital.
We're losing doctors. I mean, I was on a waiting list to get my doctor that I have now. And I got the last spot.
Right, along in the beach route, seaside, there's one maternity doctor. And if you don't have insurance that they're in your network, and you don't have access to that one maternity doctor, so pregnant women are driving for their services. If you've ever been pregnant or seen a pregnant woman, this is lots of appointments to drive an hour. There was a gentleman who joined one of our online ag and rural caucus presentations. We talked about living east of the mountains, and his pulmonologist, his lung doctor, is over an hour away if it's not snowing. If it's snowing, he can't get there. So, having access to services in all areas of the state doesn't just benefit the people who live in those areas. I go to the beach all the time. I'm sure you do too. If you have an injury, an issue while you're at the beach, you're going to want there to be doctors at the beach while you're there. So we'll talk a little bit about how Washington Health Trust supports making all of these issues a little bit better.
Real quick, Carrie, I have one quick question. So what's the gentleman, Native American, last name's White, what's his
Robin.
first? Robin White. So I was actually talking to him at an open house for one of the tiny homes. And his mother lives, they're Native Americans, and his mom lives on the reservation. They have like no doctors. I mean, our Native American brothers and sisters are really being affected by this.
Everybody, healthcare is everybody. My favorite. We have a fix. The Washington Health Trust will cover every resident of Washington State, and residency defined by the healthcare authority. So it includes folks that are here, living here on college campuses. It includes folks that live here for 6 months or more. So if you snowbird Arizona, but your primary residence is Washington, you're still covered. If you're a migrant worker and you work here for 6 months out of the year, you're still covered. It's covering everything. So yes, everybody, and yes, everything, but I'll give you more information. This really does put you and your doctor back in the driver's seat. So we get questions about why we forced to get a vaccine. It's not my business. We're just covering the bill. If you want a doctor that subscribes to that, great, go get one. If you want a doctor that doesn't, great, go get one. All we're doing is covering the bill. Put you and your doctor back in the driver's seat. It gets rid of networks and unnecessary middlemen. So all the chopping up things into different groups, and you can go to this doctor, but not that one. True choice is really more accessible in the Washington Health Trust model than it is in the current insurance model. True freedom to shop around. So that capitalist mindset, this is how we build a capitalist mindset. Really, honestly, but it's also a really great health equity tool. The current system is for profit, it's catered. There really is not a capacity for health equity, where the Washington Health Trust covers everybody and everything at the same comprehensive coverage, and still saves $5 to $9 billion annually. We will cover that. I see that you have a question.
Yeah, does it cover retirees?
It does. Yes, everything, and yes, everybody. Yes. It does, there is a gradual implementation that we'll talk a little bit about, but our executive director, Andre Stackhouse, did a presentation to the Universal Healthcare Commission that does a really good job of describing that in its entirety as the policy evolves. Because, stuff just takes time for one, but also we need waivers for Medicare and Medicaid and those kinds of things. But yes, it covers retirees if you live here as a resident in Washington State. And still covers saves $5 to $9 billion annually.
Is this in lieu of Medicare?
I'll cover that in another slide. So designing the Washington Health Trust, these are live links to our policy language. If you want to read the bill, it's available. The SB 5335 is the most recent legislation that was introduced in Washington State. We have not gotten a hearing. The first time we submitted it, is that there's not enough public support for this, so we made phone calls and wrote letters and did the thing, and then, we really want this to go to the commission. So we've been working with the commission. That's been a great platform for this conversation, but again, we have not seen strong policy recommendations come out of that group. So we have done 3 initiatives, and that language is very similar, available on the website. It's originally based on the Washington Health Security Trust Bill. This bill comes out of Healthcare for All Washington. It's another universal healthcare group, very focused on the legislative pathway. It's been involved in this work for over 30 years. And we're just beating the drum a little harder. Standing on the shoulders of giants and saying, what you've been doing for 30 years obviously isn't working. What do we do now, right? How do we do this so that it actually changes? We've taken inspiration from HR 676, which is the Medicare for All legislation. We've also used some language from the Healthy San Francisco model, which has stood up to challenges around ERISA. I'm not going to go into ERISA, but it's a barrier for state-based single-payer healthcare. And so far, we've stood up. So we've also vetted this language through the Employment Security Department and the Department of Revenue in Washington State. It's very important that, this is really solid policy, solid financial backing. It's been reviewed and refined prior to every submission, and we'll do that again. Another reason why we're after talking to all of you is so that we have some feedback into that review process. We've done 2 financial studies by Gerald Friedman. They're both on our website, and we have an excellent FAQ page.
And so, how come this hasn't been on the ballot?
We need to collect 400,000 signatures to get on the ballot. We've collected about 100,000 3 times. So that's it. We need to grow 4-fold to get to that place.
Okay.
Could also do it with $4 million. But we don't have that. So what's covered by the trust? Everything. Inpatient, outpatient, dental, vision, behavioral health, there's no deductible, there's no copay at the time of service, there's no out of network, it's completely not applicable. There are some prescription copays if you decide you want a non-generic medication where generic exists. Some folks can use the brand name, it works well for them, and the generic doesn't work. You need no place, right? This will cover it, but you'll have to pay $250 a year for folks that earn more than 200% of the federal poverty level. There are some safety nets built in for folks that don't have the resources. Because again, I think genuinely really appreciate the health equity aspect of this. Kids are covered. Their situation. State is included, out of country is not. If you're in Philadelphia visiting family and you get injured or have a heart attack, it's still covered by the trust. Not the same, you need travel insurance to offer. Rehabilitation is included. Medicare reimbursement, it starts out as a supplemental plan for Medicare. Like a Medicare Advantage plan, except Medicare Advantage is with private insurance right now, but it functions similarly. So that's how it works with Medicare to start with. So that it'll cover things that Medicare doesn't cover, your eyes, your ears, and your teeth, et cetera. Your premium for those covered. So that's how that works. And then when we get federal waivers, then all of those dollars pull in and it just functions in the background more like single payer. And still covering everything, we save $9 billion a year. My friend Catherine, who's our co-chair, likes to point out that Gerald Friedman studies actually show we save $13 billion a year if we did it exactly the same as functioning right now. But because we extend the coverage to cover everything and everybody, we're only saving $9 billion a year. And there's more information on our website. You want to talk about the housing for it?
Yes, I really like this. So how will we pay for all of this? Employers will contribute 10.5% of wages. Relieves administration burden, unpredictable cost of insurance plan for employees. they wouldn't have to work with brokers anymore.
Right.
Employees may contribute up to 2% of wages. Employees may cover all or a portion payroll deductions, not an out-of-pocket expense. Sole proprietaries will contribute 2% of earnings. The first 15,000 won't be taxed. Investors will contribute 8.5% of capital gains. So I want to emphasize that when people forget about capital gains, it's not gonna, people with their homes or retirement accounts, things that are worth taxing, it's not gonna affect that, so. And then the first 15,000 won't be taxed.
So an example, do you want to go through the example?
Employers' employee payments to the trust. Employees' gross annual pay, up to 12,000, employee contribution would be 0. Max employee contribution per month would be 0. And employees' total required health spending for employees per month would be 0. Oh, the boulder, okay, and 60,000, earning percentile would be 50th. So employer contribution would be $425, $525. Maximum employee contribution would be, this is what I love, $0 to $100, because you'd also be getting rid of your co-pays and, what is the other one, premiums. Employees' total required health spending per employee monthly would be $525. That's per year, correct? Or
Per month.
Per month.
So the reason why there's a range is because the employers can choose to delegate up to 2% of that 10.5 to their employees, right? Or they can pay it all. They could take the 10.5% because what they're paying right now is between 17 and 22%, or 15 to 17, depending on what resource you look at. They're saving money. And then they could also choose to delegate up to 2% of that to their employees. Does that make sense? Is there any questions about how this works?
You should ask a question about it. 2% top for $100. That means that roughly we're looking at a contribution of $5,000, not the employee. 0 to 2%.
Right, so 525 a month times 12 months would be a little more than 5,000 a year.
Okay.
Since the economist did the analysis in 2017, do you know any other states that have looked at putting this
Yeah.
into a plan or?
Yeah, so, Daryl Freeman did 2 studies for us. The Washington Universal Healthcare Commission has also done their own studies that show very similar savings. Commission had some influence from the insurance company, so it was a much more conservative number, but they showed $2 billion savings for the first year, and then, exponential savings up to about $5 billion per year for the subsequent years. We're transitioning from the old plan to the new plan. But even then, they showed $2 billion per year savings in there. And
But
yet, there are
we're in an election year. I just wondered if any other states that you know of are doing a ballot initiative like this.
yes, so we
Some
are all.
states don't have a ballot initiative.
That's true, not all states have a ballot initiative, it's unique for you, for Washington to have this committee, I think it's great. Democracy in action, right? Yes, there are several states that are looking at trying to get on the 2026 ballot. Utah, I'm aware of, Maine, Colorado, ourselves, and someone else is stating me right now, and part of that is strategy. Maine had a successful initiative insofar as they collected all the signatures and got the ballot, but then that, medical industrial complex came down hard with an attack ad, and they did not win on the ballot. And so we're hoping that by having several states go simultaneously, it'll spread that resource out a little bit, so we might have a chance, but go ahead.
Isn't this initiative, up against some very aggressive insurance companies? I mean, how are they taking this? I mean, it's David and Goliath, let's be honest. I mean,
It is.
this is all wonderful, and of course it makes sense. They do it everywhere else in the modern world. And yet, we're the richest country in the world, And we treat our citizens worse, so.
I love that you said that, because Wendell Potter in that Healing Us documentary literally said, this is David and Goliath, but David and Goliath. You can't win this. There are more of us than there are. It's just a matter of getting-
But they have the money.
Demanding. Yes.
Just real quickly, as a kind of a strategy for this effort, at face value, it appears that the employers would
Save a lot of money.
save a lot of money,
Yeah.
and it would be a huge benefit to them. And so just as a kind of a strategic approach for you guys, rather than going after, and getting all of the individual citizens, we're all spread out, we're all, do you guys, have you taken the approach where you're going after the employers and say, look, this is what it is, and this is what you could say? Let's go.
And both need to happen simultaneously.
Yeah.
We're developing what I would refer to as a business one pager that puts all of this stuff specifically geared towards small businesses.
Right.
That here's why it benefits you, here's what you get out of this, here's what your employees get out of this. Yes, but we need volunteers. I mean, we're a very resilient, mighty group of people, but in order to cover an entire state, we're gonna have people that are willing to go talk to businesses. Or their friends that own businesses.
It's a fixed cost to the employer. And why would they not want it? If it's not fixed every 12 months. So what, let me follow up on your question. Where's the printed matter that we can buy, that we can do this on our own?
These slides are free. I will email them to you. Just give me your email address, and the business one pager will be available soon.
Okay.
Yep. Yeah. Well, we're 100% volunteer organization right now. Like, Paul Washington literally has no staff.
Oh,
So,
there's no.
no paid staff. Nope, we are 100%
No, I've been to
volunteer.
park this summer twice and I'm not getting paid to be there.
Oh,
I'm actually paying.
What about the administration in Olympia? And his crew? There's no one saying, hey, we'll come up with some state dollars.
So, Paul Washington is a non-partisan organization and we can't endorse candidates. So, I would love to talk to you offline about
I understand.
my thoughts on that
Right.
particular topic, but,
Can we donate to you through the United Way?
yeah. So here's some of the ways that we save money, where that $9 billion comes from. A lot of it is provider penetration. Right now, providers are spending a ton of time and money trying to implement their care plan and get paid. They have entire building organizations trying to figure out the codes, the ways in which to get paid, to walk through the appeals and the prior authorizations and all that stuff. This also is time taken away from patient care. People talk about wait times. That's a way in which we can free up doctors' time to actually see patients. Market power is huge. Gerald Friedman estimates that Washington State is about the same size as the VA, who does, quite frankly, is socialized medicine and has the power to negotiate for pharmaceuticals. And they pay a significant less amount of money than we do for the same types of services in medicine. So that,
We have a vet who could talk about that.
right, so the expectation is that will have the same market power. And absolutely, Dorothy, do you have anything to say about the VA?
Well, I love it. I have not paid for healthcare for my entire life. Being military brat, then being in the military, and then now I have VA healthcare. And they saved my life. Like, I had to have emergency surgery, didn't know what was wrong, and I would have died if I wasn't insured, because I would just thought I was sick. And
The
then
problem with VA, I use it too, and I can talk endlessly about the VA. Problem is, the veteran is choosing in large numbers to step away from the VA. And it's getting to the point now where, whoa, who's being served? The ones that want the outside care with their own private, or the both of us, we want the benefit of VA, like you're saying.
Yeah.
Mhm.
Yeah, a lot of pieces are being tried to practice, not for our benefit. The insurance administration, all the time that's spent on finding an insurance company and selecting a plan and negotiating prices, none of that stuff applies. We save a ton of money there. The employer administration of those benefits, we save a ton of money there. Again, because my favorite part is for taking the insurance companies out, so all of the pieces that are dealing with insurance go away and save us money. There's also an amount of fraud detection that's available because we're all billing into the same place. So you can see deviance, if certain doctors are charging more or putting more widgets in than maybe an average, those are things you can look into. There's no incentive for insurance companies to look at fraud. Largely, they don't. They just pass the extra cost on us in our premium. Something to think about. The other thing that comes up sometimes in this conversation is the amount of insurance products that could be also impacted by a single payer insurance, single payer healthcare. Because if you think about your car insurance costs and your homeowner's insurance costs and M&I, a lot of those insurance products are based off of the cost of medical care. If we cover medical care, then we don't need to cover it in all of the other types of insurance. So it's another way, not represented on the slide, but it says save a ton of money. I'm gonna skip through this a little quickly because we talked about it already. Well, Washington has presented to the Universal Healthcare Commission. These links are live. If you'd like to see any of those presentations. Overall, what the bill does and how it's implemented, a little bit about eligibility and a little bit about finances. The important part of this is that you can participate in this process. The Universal Healthcare Commission takes public comment all the time. You can submit it via email. It takes about 90 seconds to give your public testimony during one of these meetings. I highly recommend if you're impassioned about this issue to get involved. This is one of the ways you can do that. That has nothing to do with us. Who here has been impacted by hospital or clinic closures or any kinds of limited access to specialty care? Yeah, we heard your story earlier. Thank you. Anyone else? This is huge on us. Huge.
Needed this, I mean, just getting like physical therapy that to be covered by insurance was like, it's, well, I don't want to say points, but.
Right.
So.
Right. Yeah.
And actually, you know, they did kind of come through, but I mean, it's like, you know, you're writing and you're trying to like argue and, you know, advocate for yourself. It's like, it's not ideal. And I mean, if I wasn't who I was, I guess, or had the resources available to kind of advocate for myself as I did, I mean, you know, that's how I was on one of these, you know, all Washington calls, but you know, the homelessness problem is huge. And I think a lot of that does have to do with, you know, whether people can access the medication that they need or the treatment that they need, so they don't need medication.
Universal healthcare is also protected against, you know, losing your health through medical bankruptcy. So, I mean, a lot of these social issues are definitely.
So one of the specialties that really been hit hard is mental health. Because so I have a coworker and it took him over a year to find the right therapist for him. He had severe trauma as a kid. Finally got a therapist, had him for 2 years. Guess what? They switched different companies and now he can't go to them. And now he has to try to find somebody again to build that trust that he already built for the last 2 years. So mental health has been really impacted by, and we've lost quite a few therapists as well.
Yeah, that's a really good point. I have a friend who follows nationally the PAC community, and she's comfortable using that word, so I know that there's a lot of bias in the healthcare system against someone who looks overweight, that they're somehow unhealthy or somehow not doing things correctly, that it's a moral judgment around, you know, their physical appearance. And it can take a really long time to find a provider who's just not flat rate you in that space. And then if your healthcare changes their insurance products, then you can't see that doctor anymore. They're no longer in your network. It really is an issue of access on lots of different, you know, communities, not just mental health. I also have a friend who has, who is a member of the LGBT+ community, and, you know, there's a lot of similar bias in that area for whatever reason, and, finding a doctor that's been comfortable for her women's health issues, was a struggle, and she's had to find different providers at least twice because of her change of jobs. And that kind of stuff is necessary. The product of the insurance network design and
So for universal healthcare, we wouldn't have to
we wouldn't have to
switch jobs and, yeah, or worry about losing our job.
right.
As we talk about private equity's role in all of this,
I mean, talk about private equity, except to talk about the hospital insurance, hospital consolidation, and there's companies that are buying, private equity companies that are buying that
We have a
hospital.
massive role in buying these places up, leveraging debt against them,
Right,
reducing staff, reducing hours
right.
for a quick buck. They're out, and then you have fewer doctors, less out, more.
Yeah.
And those guys just walk away with the. And Elizabeth Warren put forward some legislation to limit private equity's impact on healthcare, but anyway,
Yeah,
they have a really big impact on.
We also wouldn't have to worry about being in the network, because as somebody whose company provides insurance, one of the things the first thing our broker tells us when we have our yearly meeting is make sure wherever you go, it's in the network, even if it's blood test, anything, you need to make sure it's in the network, or you could possibly get stuck with a high bill.
right. So one of the other benefits of the Washington Health Trust is the possibility of a global budget. Global budget means that you have a budget regardless of if your entity is profitable or not. So a lot of ED closures, maternity care closures, specialty clinic closures, hospital closures are because there's not enough money in that community for the system to be profitable. I don't care if it's profitable, I care that it's profitable, right? So a global budget allows for the communities where there's not enough people to warrant X specialty, but there are still people there who need X specialty, that we can give them dollars to operate those systems, whether it's a small rural hospital or, ENT clinic, ear, nose, and throat, or whatever. And so, the hospital, there would be this opportunity, certificate of need type process. When we were in Aberdeen, we had one of the administrators from the hospital and one of the gentlemen from the hospital district come and ask some questions about capital dollars, also covered in the trust. There's a process to apply for capital dollars. So if that clinic or service covered by a global budget needs a new MRI or needs a new whatever equipment, there is a process in the Washington Health Trust for those things to be covered. It allows for smaller facilities and those servicing small populations to be guaranteed financing so that they can stay open and be available to the folks within the community, folks that visit those communities. This is normal in other universal healthcare systems around the world. It works well for them. It's also something that Maryland has tried with their system under some unique waivers to function global budgets for their hospitals to maintain Medicaid access. So you could Google that. It's very cool information. This is what we need to do. I think it's very essential. I've already talked about how it benefits everybody, not the people that just live there. Anything I should? All right. So we come back to this slide to give another opportunity for folks to share if they'd like to, their own stories around this issue, and then questions that you have. The next slide is questions. Oh, no, go ahead.
The gentleman in school went to St. Augustine, Columbia, which is 8,000 feet above Bogota, but he got to the airport, had a heart attack, and when he got to the hospital, which is the nicest, any hospital we have in the USA, in Bogota, it cost him $9,000 for 3 stints. He also talked about $1,200 for an implant. What it suggests is, depending on their exchange rate, which goes from, what was it, 2 to 4,000. We might be better off just to fly to South America. Oh, the hell with this.
I have a friend who's doing that right now. She has something happened in a colonoscopy and she's from Turkey. She's flying to Turkey, getting all of her care regarding her, whatever came up in her colonoscopy, flying home. She presented it would be for her to take care of.
Yeah, we have another friend who's going to Turkey and getting surgeries.
Happens all the time. They're medical tourism. Yeah.
My in-laws are Canadian, and my mother-in-law diagnosed with cancer a few years ago. They're retired. And down here, something like that was to happen, had to go through chemo and had to go through just some of the most arduous, difficult time of their life. they have no medical. Living in British Columbia.
Wow.
And, you know, down here, you know, people scoff at the idea of this, but how many people are just on the doorstep? Some debilitating disease or something that is going to retirement or put them into bankruptcy and, you know, when, you know, just right across the border.
So my former ophthalmologist is Canadian, and she said she did not want to become an American citizen because if anything happened to her, she can go home and get that taken care
Absolutely.
So, I guess the first time I'll say it now.
Oh, yeah.
Things that, insurance doesn't cover include hearing aids for adults, but also it doesn't cover the options of, would you rather say or hearing aids for your children, would you like to learn sign language? Sign language is not healthcare. The funny thing is, American Sign Language is the only language in America that is being gatekept by government to say, you don't hear well enough, you can go ahead and have ASL. You hear too much, you can't use ASL. But the government shouldn't have any control over anybody's language. So they're gatekeeping as if it's a tool or crutch, one's a language, and it should be right for anybody to use. But at the same time, there's nothing under insurance that gives people an option to meet other families with deaf children and learn ASL together. So that you don't have to have technology, you don't have to go through the farm. So Big Farm completely covers it. Also, kidney failure. My mom, my late mother, was told she had to eat lots and lots of meat, well, she couldn't afford it. They said that when you had to get a certain kind of whey protein, a certain brand, but they don't have that in the store. And you can get on Walmart.com or Amazon, a specific brand costs $70, and it would not be under her food stamps, even though it's whey. So she didn't have that. She's gone. For me, I've been waiting for 7 months to get one of my insurance on Medicaid to cover something I've been on since 2013. And so they're keep doing prior authorization, and I keep talking to doctors, as we did it, and so I contacted the pharmacy, Apple Healthcare, the insurance company with here, my doctor's office, I contacted all of them, I just throwing around. And they said they contacted the doctor finally. They said, we're sending up today, this is the insurance company. We can't hurry. So I don't know. About it, if I die, that hurts my physical body anymore. My current insurance, Apple Healthcare, does not cover any of the urgent care. None of them. So, get sick, oh well, no urgent care. Compression stockings. I have compression stockings because I have a gainer in my legs because I survived cardially died. And besides the insurance at the time not wanting to cover physical therapy, so I had to do that out of pocket on my own kind of plastic card college, which works. Compression stockings is supposed to get every 6 months, $70 for each one, specific brand, certain kind of pressure. I can't afford that, and it's not covered. It's considered not really important. So my friend in Arizona, she doesn't complain too much about getting insurance. However, she had a job outside of the casino and she sweat too much and it destroyed her hearing aid. The sweat destroyed it. Because the sweat destroyed it, she tried to contact the insurance to fix it. Well, America says, well, we don't make that anymore. Every like 3 years, they get rid of their hearing aids. You have to get a new one. It's another way of making money. And so, her insurance was, well, I won't pay for that one, it costs thousands of dollars. So she had to wait until January when the time came that you could choose a new insurance with her work, and she got a new insurance, and she had to go to an audiologist, she's still deaf, because that could be magic, you know? And so then she went the whole rigmarole, and a few months later, she finally got her new Baja hearing aid, which snaps on. And so it's one of those things, it's not waterproof, don't sweat. That was a job, you had to go outside at the time and throw away trash, it was 100 degrees. So the other thing was. For all my notes here, what you guys were talking. Okay, I'm a support service provider for deaf-blind people, contract with the state. I'm not hired. Same thing as a lot of our interpreters. We have a extreme lack of interpreters in our state. Just to make phone calls, they're on the job, or courts. So you might have to postpone your court thing or hospital or doctor's care, anything that a deaf-blind person will need. Well, because of that, I found out I pay a lot in taxes every year because 100% of my healthcare has to, and 100% my security, all that. There's no healthcare for you if you have a contract with the state. You have to pay 100% of your social security if you don't have a higher job. So I think a lot of interpreters are leaving Oregon and Washington, and I think California too, to go to the Midwest. For those reasons, cost of living, healthcare, rent prices.
Right.
And the other ones are like, telling people, well, yeah, I'm not a nonprofit with your contract with the state. I get more money if I get hired by an agency.
Right.
So that really affects a lot of people. I have like 1 or 2 more here.
I'm taking notes.
Thank
So
you.
that I can
You can ask me afterwards too. So I went to Gallaudet University, the only university in the world for the deaf. My major, my focus for social work and government policy work, literally, I need to go there, although DVR was like, no, you should stay around here. Like, it's not gonna help me to go around here. You don't have a deaf university around here. So it's the only place in the world that you have all the education in sign language. So I'm not the only one from Washington State who's deaf or that wants to go to Gallaudet. However, the way our system is here, number one, you have incentive to stay in state to go to school. There's no deaf school here. It's only in DC. It's the only one in the world. So if you do decide to go there, you're going to lose a lot of money. And one of the ways you're going to lose a lot of money, you have to get the branch, you have to get scholarship or pay out of pocket. Plus, you lose your EBT card if you had one. Plus, you have to pay for your health insurance. You don't get to stay on Medicaid here. So I think it's $2,000 in 2012 I paid for just a semester of campus insurance. It did cover hearing aids, but which a lot of don't. But that should be covered when you are going to school in Washington DC. You should keep what you had. And I was there on campus 6 months and home 6 months, so I had to keep switching back and forth. Let's see. So that's this is a branch I can get people to say, well, education or to stay here and be a totally deaf person. And so, yeah, it sounds funny, but it's true. It's not funny. And it
No.
really affects a lot. So I think that's everything I have right now. It's
Yeah.
probably
That was a lot, and thank you so much for sharing. I appreciate all your notes. So, I think to start from the top and kind of work down, the ASL piece is intriguing. And we've gotten a lot of these questions that are like non-Medicare,
Right.
non-medical care, but necessary for wellness and health and those kinds of
yeah,
things.
and choice.
I'm gonna have to go back and research the ASL piece, and if there's a way that we can make our policy cover those kinds of things.
I'm willing to
I'm
discuss it
intrigued.
because I studied, this is my focus, intern Congress.
Right, the one of my favorite parts about the policy is it creates a citizens oversight board. So that these types of concerns, issues
Yes.
can come through that board and be addressed even after the policy.
It's
So
one of the
if
complaints
we
parents
miss
have.
something, right, if we miss something in the initial policy, there's a way in which the citizen saying, hey, I need this, it should be covered, let's talk about it, there's a pathway for
A lot of
that.
times people say, well, the only thing that insurance cover is cochlear implant or and hearing aids. You
Right,
don't get the non-pathological
Right.
option.
right. The whey protein is also intriguing. We
Yeah.
talked about, it's in the same kind of category as probiotics for me. It's necessary for my medical care that I get this kind of thing.
Important to die.
Yeah, and the gal that spoke and left around the prescription veggies
Yes.
and those kind of things, that's not part of the Washington Health Policy right now. It's intriguing to see if we could factor that in. Love that, but just being transparent, it's not part of the policy right now. Apple Health, however, fully covered. And one of my favorite parts, because there are publicly available documents on the state website around Medicaid managed care and their outcomes, right? Track that very closely. And, if you look at a Medicaid patient's outcomes compared to a commercial paid patient's outcomes, they're not as good. And a lot of it has to do with the things that you're talking about. In our current system, a doctor's office to stay open has to chase patients who can bring in more money and limit patients who pay less for services, right? We don't have to chase that stuff with the Washington Health Trust. Colonoscopy, colonoscopy, we're all paid the same, that provider can see everybody for their services at a negotiated rate. That negotiated rate is also part of the trust policy. There's a board that's created to help physicians have a voice in that process. We know it's not gonna be, as little as Medicare, Medicaid rates, but we also know that it doesn't need to be as high as some of the commercial service rates. So what is that middle? It's something that providers will have a voice in. Also love that. So that's something that would be created, and it would help really create that health equity I was talking about earlier. It sets a level playing field so that it doesn't matter if you're able-bodied or not. It doesn't matter if you're employed or not. It doesn't matter if you're, any of the above. It covers everything and everybody. And in the same way, so that, doctors don't have to limit certain types of patients on their caseload. It does cover DME. So you're talking about compression stockings, hearing aids, those kinds of things. It does cover durable medical equipment is what DME stands for. It covers that. Pretty much anything with a billable code covered by the trust.
Yeah, because right now they call it not medically necessary. Oh, it is.
If your doctor ordered it, the trust is gonna consider it medically necessary. There is some accountability in there, though. It will look for doctors who are ordering things that maybe are a little more necessary based on evidence-based guidelines, right? So there is some accountability structure built in there. Physical therapy is definitely covered. Massage is covered. Alternative naturopathic covered. As long as there's a billable code, it's covered by the trust. Ambulance services are covered. It's ridiculous that people are taking Ubers to the hospital.
Yeah, I almost died from appendicitis because I couldn't afford to go Uber, and a friend said, I'm driving you there. So my appendix first swallows the hospital.
Yeah, dangerous for you and your Uber driver. They are not trained to handle that situation.
I'm glad you brought that up because, our ambulance bill was not covered.
Right.
Because it wasn't part of the insurance, the hospital. So in order to get my husband from one hospital to the next one, because at the time there were only a couple hospitals that had heart surgeons.
Yes.
He had to, take an ambulance with a balloon pump in to one hospital to the other. $3,000 out of pocket, none of that was covered, we had to pay.
Yeah, when I was hit by a car, they said the best place for me to have skin graft was in Portland. So they drove me all the way. When I was in Hazelville, was that one because that's where the specialist is. And while I was in the hospital on morphine, I was so weak, I couldn't write a check and I had a checkbook. They were harassing my mother and my grandmother at home, calling the ambulance saying, pay now, we will destroy him, we will ruin him. It's like, he's gonna die. Tell us he'll live or die in 10 days.
There's a lot of doctor's offices and dentist offices that won't see you unless they get payment up front.
Yes.
It's really terrible. Let me get through his list.
I want to ask you on the same point, transportation. You're in the medical field.
Yeah.
There are a lot of nonprofits that are providing transportation, but how the hell do we know in our community
Right.
what is available?
Right, yeah, it just shouldn't be this difficult. Contract employment, so gig workers, contract employment, all those people are covered by the trust. They're funded the way we talked about how they're funded. If you're a sole proprietor, you make more than $15,000 a year, that comes out of tax. If your employer employs you for a part-time, they still cover whatever that percentage of your wages are as a tax. That also helps them not have to play the schedule game. There's a lot of corporations right now that are working people just enough that they don't fall healthcare benefits. Get rid of that, gaining the schedule practice. I mean, this could really simplify.
That's what Starbucks place wants, right?
A lot. The last thing you talked about, unfortunately, nothing I can do to help you. If you don't meet resident requirements, then you wouldn't be covered. So if you're gone longer than 6 months or whatever with your university.
6 months to 6 months exactly.
Well, then.
That was if they brought the board, so it was hard.
Right?
That's one of the things the legislature report Congress wanted to, needs to be talked about, to say that this is an inequity that you're forcing deaf people to not get education where there is less barrier and more inclusion.
But that's also one of the reasons from the healthcare perspective, why we advocate for both a state-based single payer system and a national
Yeah.
single payer system. We're really hoping that one state will go first, and I don't care which one it is, if it's Washington, great, if it's Colorado, great, Oregon's got a really great universal healthcare commission running right now, they could go first as well. Colorado bill didn't go through, California's got AB 2200, which I think just failed again.
Yeah, because that's a good.
Not even as far along as it did last time, so I mean, we are working on this everywhere across the country, I don't care who goes first. The first one that goes, we really believe will create a floodgate for.
Because people will see how effective it is. And
Right. Right.
I mean, my dad's on Medicare and he actually, luckily he was in, retired from the military, he had to go through the VA to get his hearing aid. If he couldn't afford it through his Medicare.
Yes.
Okay. In the interest of time, this slide I added after our last presentation, just to make sure that there's a bit of balance in here. Why aren't we doing this? So I did Google, what's coming from the opposition, right? The main source of opposition are really the industries making money on the current system. That's just the reality of the situation. Their talking points are the inefficiency of government-run healthcare. We hear this a lot. The state-based single payer system is not government-run healthcare. The VA is working just fine, by the way. But we're just paying the bill. It's essentially a state GoFundMe, publicly funded, that is paying the bills, cutting the insurance companies out. The benefits of free market and competition. There's a really great few minutes of, Dr. Jarvis is a public health doctor in Utah, I believe he's Republican.
He's Republican.
That is a single payer healthcare advocate, and he talks about the free market in the Healing Us document. And why the invisible hand of the market is not applicable to health. Because it's not like a TV where there's a whole bunch of TVs and I'm gonna go find the biggest one, the best one, the one that fits my needs, right? And there's competition for that TV, everybody wants one. If insulin, I don't need insulin, it doesn't matter to me how cheap it goes, I'm still not gonna buy it. But if I need insulin, the insurance companies and the drug companies can jack up the price of insulin, I'm gonna buy it no matter what it costs, because I need it to survive, right? So these are not free market principles, they don't apply to healthcare. The increased cost of the government level, we've shown in our studies, the Washington State Universal Healthcare Commission has shown in their studies, there's been several other studies. This doesn't increase overall cost, it costs shifts. Right, so we're taking in tax dollars instead of collecting insurance premium, it costs shifts, it really does. And then increase wait time, this is true, we will see an increase in wait time. For about a year on average, they've studied this across the implementation of 36 other countries. And because we've been delaying our care, because we've been avoiding the bills associated with that care, there will be a flood of people going, oh wait, I can go see the doctor. And they will, and it will impact wait time for probably at least the first year. So that levels out on average after that first 12-month period, because people realize that, you know, they got what they needed. We don't need to keep going for no reason. And I did link that, Dr. Jarvis bit, so that folks have that accessible to them if they like it. I also linked the, resource for where this information comes from. There are a few hit pieces. If you Google state-based, if you Google SB 5335, so our bill, there are a few hit pieces around the capital gains tax. That they're coming after your houses and your retirement, and I just want to re-emphasize those things are specifically exempt from that capital gain tax that ties to the healthcare trust. So, I was a little flippant at our last meeting and said it's lies and propaganda. I really, truly, genuinely think we've proven that a lot of this is, you know, really benefits the industry is making money to put this information out here in a way that scares people. What we're dealing with is the cost keeps going up. And so change is scary. And what if it gets worse? And, you know, but I really believe that single payer is a good way to go. The League of Women Voters really
supports and not leading yourself against the misleading ads that we know are coming. Based on questions, I did talk a little bit about Colorado and the just millions of dollars that were pumped into attack ads when they were going to vote on this issue. There are vested interests in the status quo that do not want to see the billions of dollars they're currently making. They don't want to see that cash cow go away. So Medicare for all is not a public option. It's not Medicare for some. It's not Medicare Advantage, which I think is poorly labeled. It's very disadvantaged. It's not an NHMO. It's not an APO. It's not socialized medicine, and it's not government run. So just put those in your pocket, I guess, for folks that really see it this way, because we've been just flooded with these ideas in our media.
I actually had, a lady who works for the insurance company, and I was down at our Brookfield Dent's booth promoting this. She got pretty aggressive with me, and I had to really like step back, because I mean, she was just going hard at me and how the Affordable Care Act is perfect and it covers everything and it's a way to work around things. And I'm like, I'm not gonna get into this conversation with you. I know where I am and how I feel. Cause it was like she was trying to get me to do that argument with her. And it's like,
Right.
no, if I'm in a public space, I'm
Right.
not gonna argue with you.
Right, and healthcare is an everybody issue. I don't think it matters what your background is, I don't think it matters if you lean left or right, I don't think it matters. You know, it's really an everybody issue. At some point in your life, you're going to need to access healthcare, and it shouldn't bankrupt you, and it should be high quality, it should be easily accessible, it's
Human right.
in your area. Go ahead, sir.
Okay, so my question, back in the 1980s, now you had a chart there. Things weren't too bad in the United States in the 1980s. It was actually second worst. I should say my grandma knew a couple that moved here from England. They got on the waiting list, the lottery system to get here. And the reason they came here was they couldn't stand the British long wait times to see medical care. And they were getting elderly. They were like 70 at the time.
Yeah.
So they probably passed away now, but they lived here in Washington State. So I wanted to know what your thoughts are, if you know about medical care back in the 80s to today, and how the English system works. And the long wait times to get something when you're elderly compared to like what
This
this
is?
is. Yeah.
For sure. So the NIH, the National Institute of Health in UK, is a fully socialized healthcare program. The government runs the hospitals, they employ the doctors and the nurses. So if you're looking at a budget, then you're covering everything, all of that, as like the employer in that situation. That's not what we're doing. The doctors are still their own practices, the hospitals are still their own entities, the whatever aspects of the
Like
healthcare
Vancouver
system.
Clinic, for example.
You're just paying the bill, period. We're just taking the insurance companies out of the middleman and paying the bill through publicly funded.
It's not the
If
government.
they'll accept a contract at whatever figure, it's negotiated. Our doctor didn't cost you this much,
Right,
the trust said, okay.
right. But there's incentive for us to make sure that that's, working, right? So the Friedman studies were based off of the
Oh,
concept that providers would not want to take a pay cut, right? So we're gonna pay you at least as much money as you're making right now, and also, change the system in which you're getting paid. They won't have to sit on the phone for prior authorization, they won't, I mean, we're improving the system for providers in a lot of ways, and also paying them the same amount of money.
great presentation. I applaud you and all of it. But you started out by saying, you never know, because if you go out of the state and you're covered, the anesthesiologist might be not under the preferred plan, and so your bill's gonna be higher. That's
That's for employees.
That's happening right now.
Excuse me, I mean, I didn't say it correctly. That's true.
Yeah.
And so are we ever able to know what it's gonna cost to do a procedure?
Yeah.
Well, here, no, I mean, President.
Right now, no, it's a number of different brands. I mean,
Yeah, that-
it depends on not just am I Blue Cross regions or whatever, but also which Blue Cross regions plan do I have, and which, there's so many layers of.
This
where
is
those
a
costs are
no-brainer.
different. I think so too.
Thank you.
I mean, you just have the battle between the legacy and Providence, it's not like to Blue Cross.
The ball in the back.
Right.
Just like remember.
It's on the road.
Here's some ways you can get more information. Again, these slides are available if you want to put your legible email address on the screen. Thank you so much for being here. I'm happy to take more questions.
I had a question about strategy, and you know, you had mentioned that there were some studies that were done by like the Washington State Department of Health highlighting the benefits of this universal healthcare implementation. Is there any way, has it been looked at, or is it even appropriate legal, I don't know, like to maybe like engage with like county public health?
Yeah,
Or public health?
Yeah.
I mean, are they in a position where they can advocate for this, like with local employers? I mean,
Yeah, I think that,
Oh, I
I
see.
think the answer to your question is somewhat complicated because of their,
I see.
right, employed by the state. But as a, but as an individual, we're absolutely empowered to
Thank you.
participate in these. Right, so to provide public comment, to call our representatives, to email them, to tell them, I saw this really great presentation, I'm really curious why this bill is in hearing. I'm really curious why the Universal Health Trust does not, or the Universal Health Care Commission isn't strongly recommending, you know, strong based.
So it's like maybe something we as individual volunteers could reach to, like community people or county health directors and kind of say like, hey,
Yeah.
right, maybe. look
Yeah,
into it.
and we've done some presentations, so happy to come and talk to a group of people.
That's my question. I'll cut you short.
Yeah.
Can we get a copy? Can we buy a copy of this and take it to the neighborhood and have our?
You're not the right one.
What I'm saying is the neighborhoods are, some are very tight and some are not.
Yeah.
And one of the things we
Your
decided
neighborhood
to do,
association, absolutely.
we want to do a newspaper, a newsletter. We
Yeah.
did over many decades, but this time, just hard hitting information, just
Yeah.
in your face. And
Try to get them honest.
right, can we buy this
I
for?
will give it to you for free.
You know.
Donate, you can absolutely donate to the Washington, but yeah.
Yeah.
Full access.
Peace and Justice is one of the places that's there, and it's in Denver. and-
Will,
I will be there.
we were there last year.
Oh, really?
Yeah, yeah.
Well, one of the things that makes the deaf community not participate in elections with them is because number one, it's not science, it's not culture, life, but another one is because it's not accessible information, they just really feel like they're completely disenfranchised, they don't have an idea what's going on, and nobody really cares about them, and they're not gonna want to bother to deal with. But that said, have you tried to reach out to the deaf organizations?
Yes. Yes, and some of them, I do a lot.
Oh.
The wall is saying
Yes,
about kind
I
of
see.
line. Not a lot of back.
Well, then it depends which ones you contact. I probably don't remember, yeah. Okay, so I'm not talking about HLA. I'm talking about that. Because you may or may not know, offices have to be hard of hearing, they're a government, so they might not be able to,
Right,
okay? But the Washington State Association, yeah, could.
yes, yeah. And there's also like the lived experience of
Premises, I know.
then there's another one. Whose name escapes me, but we got actually a lot of really good feedback from me on how to make my sector and them more accessible.
Yeah.
So I presented at least one group that, you know, has.
Yeah. The ASL, not talking about anything else. And so Washington State Association that has a listserv, they send out an email to everybody, others are fans. But you can also contact the two deaf centers in our state, one is in Seattle, one is from here. And you could have their CEOs, maybe, use their interpreters to be with you. That's nothing resignation.
Yeah.
Yes, that's it. So, I gave you.
Before it rains again. See you later, Susan.
This is going to benefit families, and it will cover everybody, whether they work or not. then you could end up having thousands of people on board with this.
What I've noticed works best, the reason why we're doing it, is that, foot in the door, right?
Right.
Yeah.
What's your first name? David. So if I think David said, I should come talk to you. If I got a mom, then I have someone that I just-
Exactly. That's why some people, you know, see they go home and told me the concept. Definitely is very. Weird hearing from stands. Oh, this is the effect of. They're really not. They won't even start paying. And it's. For the Vancouver, Washington, I met David Poland, I know him, and you're like,
Yeah.
and he told me that I'm gonna contact you, this is the deaf community, and that they don't get all work together. This is
You had
how.
that?
I'm gonna say hi, guys. Okay. You guys end up saying, nope, we're gonna have a construction, and then I'm gonna say hi and bye.
Forgot. I'm just being regular. Private flight.
I did, are you gonna run,
Maybe.
Kim is running for
With their.
I don't know.
You name signs, I was so.
Well, it should be,
So excited.
so off here. So it should count as off here. So she'll be running in 2025. So, one of the things I'm actually gonna be looking in, because I really advocated strongly when I ran, is that we need to change our city code to district wide. Because we have a lot